that we've identified roughly 7,000 hotel rooms that are now in our possession, where FEMA is providing 75% reimbursements for this project. FEMA has specific guidelines as it relates to Project Room Key, this specific program. Again, number one, if you're COVID positive. Number two, if you've been exposed to the virus. And number three, the third category is high risk. And high risk is defined many different ways. Easy way to define it, 65 and over, but people that have many other underlying health issues. We are working with the counties as they identify these sites and to make sure that we have essential staffing needs met at these sites. We are doing laundry service. We are having an intake process that is appropriate to the site, to the extent security is an issue. So that's the framework of what we're doing. Phase one, 15,000 units. But we recognize the county stress, the city stress as it relates to resources. And that's why it's important that I remind all of you that we have provided some $800 million. $800 million of grants, $150 million of the new dollars that are now out to support this effort, 75% reimbursement from FEMA. These operating agreements or these occupancy agreements at places like this include extensions and all the new templates that we have just engaged in the last few weeks include purchase options. Reported 10,710 in the state of California. We have 2,188 individuals that are hospitalized and 901 individuals in our ICU. We continue to do more and more on testing. Tomorrow, I'll be putting out some more specific and prescriptive strategies and guidelines and updates on our testing protocols. The amount of PPE that we're receiving from around the world through our own efforts, and again, with whatever support we can get from the federal government. We have, as of this morning, distributed now just over 38 million N95 masks in the state of California. As I said, as soon as we get those masks in, we get them out as quickly as possible. You need the physical points of access in our hospital system. You need the appropriate protective gear and supplies, ventilators, not just gowns and masks. And of course, we need the people that are retired to come back. And so certainly national models that show April. We're iterative in terms of incorporating new data sets, new trend lines, and updating our modeling. We were looking into the May month that we started to see things begin to peak. Clearly, the national stockpile will be insufficient to provide the ventilators that we'll need and the ventilators that will be needed for the rest of the country. And so that's why we're not relying on the national stockpile. By the way, we haven't received one ventilator yet, and I don't anticipate anytime soon. I want to clarify, roughly 170 ventilators that did come from the national stockpile. Those didn't come to the state of California. There's a separate agreement in LA County. As you know, we had to refurbish the vast majority of those. We have over, you've heard this number before, 4,252 ventilators that we have sourced ourselves and identified. We have a few hundred more that came in this morning. Not all of them are working. We're going to get them fixed. I very specifically mentioned in my remarks yesterday that there are many businesses, tens of thousands of businesses that do not and cannot get the support of the SBA. Those individual businesses, we are making available these emergency grants through our iBank to do these micro loans to provide access. That's an example of what we're doing to provide support for people across the panoply, including those without documentation.